my name is Lorraine Chapman, and I am the healthcare practice lead here at Macadamian, a user experience and software development consulting company specializing in digital and connected health. I have here with me today Nate Treloar, who is president and COO of Orbita. He leads business strategy and operations in connected home healthcare technology solutions. And Nate is here today to talk about the role of connected health in creating a more engaging, meaningful, and useful experience for clinicians and patients. Welcome, Nate.
Thank you, Lorraine.
So, Nate, it seems to me that Orbita is in the epicenter of connected health, meaning your platform and its capabilities facilitates the connection of different healthcare endpoints, both clinical and patient/consumer. Across the continuum of care. Can you just give us a quick overview of what Orbita is doing?
Yeah, we're a software company focused on enabling technology for providing a way to connect to patients in their home for home health care. And our emphasis is really on serving the needs of what we consider the three key stakeholders in home health care. Of course, the patient themselves, and providing a way for the patient to be more engaged and empowered in their own care. The clinicians, the people who are caring for a population of patients, providing data and information to inform how they provide optimal care to patients who are not in their clinical settings but are being cared for at home. And then the third stakeholder persona is the family and friends and caregivers that are really advocates in serving the needs of the patients who sometimes need that little extra help from their family members. So we see those three individuals as key roles in the solutions that we enable. And the way we do it is we provide the technology that connects the patient with their family and friends, connects the clinicians with the patient through user experiences and dashboards and interfaces with electronic health records, et cetera. But importantly, it creates a collaborative care journey management experience for all those participants. We think that connecting to a patient in the home setting with their clinicians is more than just strapping devices to them. It's really creating an engaging collaborative care experience.
Great. So can you tell us what were the key drivers for entering this space and Orbita's value proposition?
Yeah, well, we were motivated to start Orbita for a number of key reasons. Maybe like many others, that there were three forces that we saw coming together that were compelling a drive for more and better care in home settings. Economics to start, particularly in the United States, where the cost of healthcare is really compelling policymakers and healthcare businesses to figure out how they can deliver the same quality or better care at lower costs. And it's not necessary to even eliminate that healthcare in the home settings. It's much, much cheaper than healthcare in clinical settings and hospitals. So the economic forces are there. Policies have been made, again, in the U.S. in particular, to compel healthcare providers to look at ways to deliver lower cost care. And home health care is certainly a strategy they're pursuing with vigor. The other thing that we see happening is just an aging population and demographics, where you see more people aging into Medicare, for example, and with chronic care needs, and all of them, like all of us, would rather be cared for if we could in our homes. So that's certainly informing how we see this all coming together. And the last thing, and where we come at it, is from the lens of technology. We see connected devices, ubiquitous network connectivity, and things like smartphones even really being at the center of a new wave of technology that's making healthcare and healthcare monitoring in home settings much cheaper and frankly better. In some cases, we could do things in the home that until recently could only have been done in clinical settings. So those are the three kind of forces that we saw. Actually, there were some personal reasons for pursuing the business. Many of the founders have had experiences being caregivers for aging and ailing loved ones. And we saw firsthand how challenging it is for both the patient and for their families to be empowered to provide care for somebody outside of clinical settings and in homes. So we were very motivated figuring out how we solve these very large problems of better care at home. So our value proposition around all of this is really oriented around empowering the patients and enabling patients to be active participants in their own care to the extent that they're able to, creating collaborative care experiences that drive more collaboration and coordinated care around that patient among clinicians and their care providers, and really ultimately delivering better care at lower cost, reducing risks. Among the technologies that we've been looking at and have been deploying, it's not just medical devices that we see coming front and center. Lifestyle devices like wearables and fitness bands, and even more, especially recently, devices like the Amazon Echo and voice assistant technologies we see as really truly transformative in the way patients can use these tools to better care for themselves, better communicate with their friends and family and clinicians.
Absolutely. And this is what I love about the story that you guys are telling through the Orbita platform. Is the fact that you've put people at the center and then looked at a variety of different technologies to help meet their needs rather than the other way around. So as you noted, the voice-assisted technology, I mean, tools like Amazon Echo have gotten a lot of press and adoption in the consumer world. And now we're seeing it, especially here at Macadamian, the adoption of it to help with remote care monitoring and provide assisted living in the home. So can you talk a little bit more about how the concept of the virtual assistant changes the remote care paradigm, in particular the impact of voice or conversation on the user experience, especially with the older population?
So I'll share with you an epiphany I had when I first got an Echo Dot about a year ago. And I loaned it to a neighbor of my parents, an 81-year-old vision impaired gentleman. And I gave it to him for about 2 weeks, let him just play with it, just using the standard tools and features of the device to be able to play music and check the news, et cetera, check the weather. And when I went in to check in on him and retrieve my device, I said, "How did it go?" And he said, I bought one. He said, "This thing has changed my life." No uncertain terms. He said, "This has changed my life." And it occurred to me, okay, well, if you're elderly and at home, that's one thing. But if you're vision impaired and you don't even know what the weather is outside the window, something like this can indeed be transformative. The ability to just say, "What's the weather?" and have a voice assistant answer you and help you understand, how to prepare for your day. Never mind the other sort of empowerment features, like just being able to send a message or get access to music that he loves. All these things created a new level of engagement for him through this device and empowerment that he never had. So we kind of took that idea and said, it's really more than just another interface. It's a new way of creating an experience that engages a patient outside of just one thing, treating their chronic illness. So the fact that we can extend the Amazon Echo and other assistants with care functionality that allows them to check their medication, confirm that they're adhering to a treatment protocol, message their care team, coordinate care schedules, all these things which they normally would do through phone or other things, through this device creates a new level of engagement for that patient, while at the same time creating data and information that informs their caregivers and their clinicians in ways that they were never able to be informed before.
Great, and you've set up a wonderful picture of how this can help support people in their homes in a much broader sense than just health-related needs. What potential role do you see these devices playing in helping healthcare organizations achieve the triple aim, for example?
Well, if we think that patient satisfaction and quality of care is one of the principles of the triple aim, the fact that the patient is truly engaged and empowered and motivated to be a participant in their own care certainly checks that box. And the fact that they're able to do that in the comfort of their own home is a key part of that. Being able to provide that higher quality care is predicated on having insight into how a patient is adhering to their treatment, having insight into when the patient is struggling. If the patient's able to say to their voice assistant, "I'm having a bad day," or "I'm in pain," and the voice assistant can at least capture that information and share it with a clinical care provider, that's information that would be otherwise very difficult to get other than short of having somebody call that patient or having a family member report it. So we think that the quality of care goes up. The outcomes improve because you're mitigating risk, you're reducing emergency calls by providing a way to intervene when anomalies or moments of risk show up in the timeline of care for that patient. And then the third thing, because you're delivering this care in the patient's home as much as you possibly can, they're not going into the clinical setting, the higher cost settings of care. So you're addressing the third aim, which is to keep the cost low. So we think that this checks all three boxes.
Okay. So obviously there's huge upside and a lot of opportunities and benefits. We haven't really touched on the challenges that could potentially come our way in terms of patient engagement and how that's evolving and how as we all become more connected at home. Can you speak to some of the challenges that you see coming our way in the future?
Yeah. Well, I will be clear. It is early days in the use of technologies like Amazon, Alexa, and voice from system technology from Google and others, and how they can be applied most effectively in healthcare settings and home healthcare in particular. Fortunately, some of the challenges that we see kind of coming forward around these types of technologies, there is some precedence for dealing with them in things like interactive voice response systems, automated telephony services if you're calling your physician over your phone. There's some similarities and some patterns that we can learn from there. I guess I would lay it out on a number of different levels, but I'll kind of check them off. First off is voice assistant technologies and even connected technologies don't work uniformly for everybody. Every patient is different. Their needs and abilities are different. Their conditions require different types of interfaces, devices, support, whatever. The Amazon Alexa isn't going to work for somebody who has a speech impediment or can't, for one reason or another, clearly speak into the voice or to the voice assistant. It's not going to work for somebody necessarily, as it is right now, who's hearing impaired. And it's not going to work necessarily for somebody who has other cognitive issues that prevent them from engaging with the voice assistant. So it's not for everybody, but nor is a Fitbit for everybody or a connected motion detector. So our attitude towards connected experiences and connected devices is that you want to be able to leverage the technology that's best for the needs of whatever patient population you're trying to care for. There are other issues that have come forward with even very kind of specific issues with the Amazon Alexa, which is that it's an always-on, always-listening device. There are anecdotal stories about people having their Alexa kick in with a response when they never said anything because they heard some ambient noise in the background. And that's a new problem. We haven't really experienced these kind of problems because the concept of an always-on, always-listening voice assistant is just really in the last couple of years. So our attitude, and then the third thing on that is really security. It's brought up all the time. If this device is always on, always listening, what's to prevent somebody from coming into your home and speaking directly to the Amazon Alexa? So these are issues that are being resolved and can be resolved. In the case of that last one, we can require that interacting with the voice assistant requires that the patient give a 4-digit PIN, for example, and actually speak it into the system. Of course, if somebody knows that PIN, they can just speak directly into the system. That same problem exists if somebody comes into your house and picks up your telephone and calls your health service provider. Like I said, there's some patterns that exist and have been addressed in other situations. But we're still learning, and it's not for everybody. We believe that, like any technology, it's about trade-offs, risk versus benefits. The example I like to give is that many of us now have these devices in our car that allows us to go through toll booths without having to stop and exchange currency with somebody in the booth. We're willing to give up some privacy in exchange for the 30 seconds that we save exchanging currency at a toll booth. And that trade-off, and I don't want to belittle the importance of securing these type of experiences, but what we see happening is that out of the gate, we see a willingness to give up some privacy in exchange for simple informational access services and information exchanges. We're quite a ways from the ultimate end of the spectrum where these kind of connected experiences can actually prescribe and even dispense treatment through a connected experience. Sort of this virtual robot doctor. We're not quite there yet. And I think we will get there, but it's kind of more of a question of time. We're focused on sort of checking off the most valuable and low-risk things we can do first.
So finally, can you speak to the security and HIPAA concerns with integrated voice-assisted technologies and healthcare platforms, especially as it relates to our personal information in situations where maybe it's being used in a hospital inpatient environment or even at home with other people around?
Right. Well, this is a question that comes up quite often when we talk about how these devices and voice assistants can be used to inform care and collect data about a patient who's being cared for at home. So there are technical answers to it. Without getting into too much detail, there is a way to kind of obfuscate the identity of the patient as it goes through the device and to protect their identity and protect the personal information, that health information attached to that identity. The other technical aspects of it are making sure that data is fully encrypted from end to end. And in our implementations, that is definitely the case. As it relates to HIPAA specifically, HIPAA is both a set of policies and procedures as well as technical commitments that you make in order to protect personal health information. As a company, we're HIPAA compliant in respect to all of those dimensions. Alexa, the Amazon technology, Amazon has not claimed HIPAA compliance for the Alexa technology. So anything that we do, even though it's all encrypted, we can check the box on that. What we really need to do is make sure that the data that's being passed through the Alexa application, that experience, is not exposing anything that would uniquely identify that patient or the information that's attached to it. So that's just the kind of technical aspects. As it relates to how people can use the device and opportunities for somebody, for example, to come into your home and interact with your Alexa application, that is definitely possible. There are ways to prevent that and avoid or make it impossible for somebody to access a particular feature on the device by doing something like setting a personal identification number. So in that example, you would say before you can engage with the application, you would say, the application would ask you to provide a personal identification number and confirm who you are, similar to using an ATM. The other thing to point out is that there is a precedence for how to secure these voice-powered experiences. Interactive voice response systems that take advantage of telephones have been around for years. So when you pick up your phone and you call your healthcare provider or you call your cable provider, they know who you are based on the phone number, and they can require you to authenticate that you are the person who you say you are through various means. So that sort of back and forth and authentication and authorization is possible to do through these voice systems.
Great. Well, thank you so much, Nate. It was wonderful having you here today to talk about Orbita's product and what you're doing in this particular area. For anyone interested in learning more about Orbita, please check them out at booth number 7281 at the HIMSS conference in the Connected Health Experience area. So that's HIMSS 17, February 19th to the 23rd in Orlando, Florida. Or you can check them out online, www.orbitahealth.com.